Hello, my name is Oliver Klar, and I would like to welcome you to my talk today with the title Estimation and Monitoring of Operating Room Utilization by a Distributed Streaming and Analytics Architecture deployed at Heidelberg University Hospital's Medical Data Integration Center. First of all, I want to give you a short overview about the talk today. I will introduce you to the PART project. I will talk about the problem statement and the objectives. Afterwards, I will talk about the Medical Data Integration Center, which we are building here at Heidelberg University Hospital. Then we go into detail into the core of this work, which is the extension of the Medical Data Integration Center by the developed PART components, including the monitoring and utilization dashboard. At the end, I will give a brief conclusion. As I said, my name is Oliver Klar. I'm working at the Institute of Medical Informatics at Heidelberg University Hospital. And I'm part of the working group Medical Information Systems. Our research focuses health telematics and networking, integration of IT and medical technology, and information systems for medical research. For the last 3 years, I was working in the PART project, which is funded by the German Federal Ministry of Education and Research. And we had 2 partners. First, the GADV, a software company specialized in test automation, and second, Karl Storz, a leading endoscope manufacturer. Let's begin with the problem statement. As you may know, operating rooms are a major cost factor in a hospital's budget. Therefore, process optimization and workflow efficiency plays a decisive role. Hospitals want to relieve the medical staff, want to have the focus of better patient care, and of course want to lower their costs. If you want to optimize the processes, you need to understand the processes and to measure them first. However, often in the currently used OR management tools, there are several drawbacks. One of them is that the data, the relevant data, has to be entered manually. So this can be incorrect, inaccurate, time-consuming, and incomplete because those data is entered during surgeries, which is an additional task in a stressful situation. So basically, OR planning is done on experience by OR managers and surgeons and those numbers. So due to the mentioned problems, our focus or our research goal was clinical process optimization by collecting, analyzing, and visualization of OR sensor data. By collecting and analyzing this data, we wanted to get a holistic picture of what is happening within the OR. This gives us the possibility to monitoring the state within UR in real time, which enables a quick reaction to unplanned incidents. And second, recording and retrospective analysis of this collected data, of course, helps understanding the processes and thus can help to improve them. Now I want to introduce you to the Medical Data Integration Center, shortly MEDIC, here at Heidelberg University Hospital. It provides a multi-purpose medical data integration environment to support clinical care as well as biomedical research with thematically enriched, high-quality clinical routine data. It brings together data residing at various data sources spread over the hospital's IT landscape. And it enables a holistic data view on patients, resources, and processes. For integration, the data, internationally established open interoperability standards like HL7 FHIR, DICOM, and OpenEHR are used. Now, I want to go into detail about developed components within the PAR project and the integration of those components into the MEDIC. On the right side, you can see the IT architecture of the MEDIC and colored in red, the newly added components. Let's start with the source layer on the bottom. The source layer includes all primary systems. So in this project, we added 4 operating rooms from the surgical clinic. From each operating room, the data of the wall-mounted IP-based cameras and the data of the medical devices is ingested in the MEDIC. Next, I will talk about the integration layer. The integration layer was extended by a Kubernetes orchestrated Apache Kafka cluster. It serves as a distribution point for the ingested data. The data analytics layer is extended by 4 components. First, we use Elasticsearch as a data store. In the data analytics components, we added 3 components, 2 for the video analytics and 1 for the device analytics, which is the medical device data analytics, the video feature analytics, and the AI video evaluation. The service layer on the top was extended by an OR monitoring and utilization dashboard. After giving you an overview about the newly developed and added components, I want to go a bit more into detail about the data analytics. As I said, we want to establish a monitoring and utilization system for operating rooms. On the one hand, we want to have utilization numbers of those rooms, and on the other hand, we want to get a real-time state of the operating room. So, and for the utilization numbers, we use the device data. For the real-time state of the operating room, we use the video data. So let's start with the medical device data. So as I described, from the integrating operating rooms, every time when medical devices are used in those rooms, data is sent or ingested in our system. So what we did is we merged those data streams to one medical device data stream. And on this merged data stream, our analytics is done. So the idea is every time when a device is used, the operation room is used. And on this idea, the numbers are derived. For the OR state estimation, we developed 2 video analytics components. First, the AI video evaluation. It is based on a deep learning approach which extracts 2 features from the video stream in real time. Feature 1 is the number of medical personnel currently in the OR. Feature 2 is whether the patient is in the room or not. This AI video evaluation component transforms the video stream automatically in an event-based feature stream. Those features then are sent to the next video analytics component, which is the video feature analytics. Now I want to talk about the OR monitoring and utilization dashboard, which we developed. So in the dashboard, you can see the results of all our analytics components. On the right side, you can see that the dashboard shows all available operating rooms of the surgical clinic. A rectangle shows whether a room is active, then it's red, or inactive, then it's blue. This information is derived from the merged data stream, which I talked about earlier. On the bottom, you can see one specific operating room and the calculated numbers of those rooms. So you can have information about the total numbers such a room is used. The average time of one usage, the average usage time per day, number of times it was used per day, and the utilization as the ratio of hours used and total number of hours a day. On this slide, you can see the results of the OR state estimation based on the video analytics components. On the right side, you can see the part dashboard. It shows information for the patient and for the medical professionals. 3 states are shown. State 1, room is active. The patient and 1 medical professional are in the operating room. The dashboard shows this accordingly. Further, the entry time is shown, and when they leave the room, the duration of both is shown. For the patient, the turnover time is calculated. State 2, room is active. The patient has left. The turnover time and the duration is calculated. 1 medical professional has entered the room. In the dashboard, it is shown by the number in the middle of the circle. State 3, room is inactive. The patient and the medical professionals have left the room. The duration of the medical professionals and the duration of the patient is calculated and shown in the dashboard. Now I will come to the conclusion of our work. The presented work provides a new service towards clinic process optimization and decision support within OR and gives users, e.g. the OR coordinator, a tool at hand that enables live coverage, utilization and short-term monitoring of 4 integrated operating rooms of the surgical clinic. However, to improve results, the connection, aggregation and analysis of more data sources is necessary. And I have to mention the proposed system, and particularly the AI video evaluation system, was trained and tested with statists. It did not run during real procedures due to high data protection hurdles. Therefore, clinical studies are planned for evaluation the system under real conditions. Thank you for your attention.